And I think we'll get started. So good morning, maybe good afternoon if you're not in this time zone. But I'm JC Abu Said, CEO of Halbert Hargrove, and I have the pleasure of introducing Dan and Monica. We've had a relationship with Dan's firm for decades. Both of them have very extensive experience. Of course, the main topic today is Medicare. And I think you will get a lot of great content, a lot of intelligence on the matter. And let me do some housekeeping. So we sent the slide decks this morning somewhere around 10 o'clock. So if you didn't get them or if you want them and can't find them, just let us know. Also, we're recording the session and it'll be sent to participants in about 2 weeks. So stand by for that. Lastly, but importantly, the Q&A. There's a Q&A box at the bottom of your screen. So Dan and Monica want us to accumulate those questions and they'll answer them or address them at the end of the meeting. But again, we won't do live Q&A, rather just type your questions in that box and they'll address them as the webinar comes to an end. And with that, Dan, Monica, please take it away. Thank you.
Thanks, JC. Hi folks, I've asked Monica Fernandez to provide you folks the information on Medicare this morning. And principal reason for that is she's our resident expert on the subject. Monica's devoted her entire 20-year career with our firm to acquiring the knowledge and understanding of Medicare and also how it impacts the beneficiaries of Medicare. So Monica, please.
Thank you, Dan. Okay, so let me share my screen really fast. Okay. Okay, are you able to see it on your end, Dan? Just to make sure.
I am. If you can make it a little bigger, covering the whole screen, or otherwise it's just perfect. Thank you.
Let's see. That's the biggest.
I think
is
we're fine.
Is that better?
Yes, thank you.
Okay. Okay, no problem. So before I begin the presentation, I wanted to disclose that this is not a sales presentation, but for educational purposes only. Okay. So today we will be going over who is eligible for Medicare, your coverage options, when can you enroll, the next steps you want to consider, and any questions you may have at the end. So who is eligible for Medicare? If you are a U.S. citizen or a legal resident for at least 5 consecutive years, and you're either 65 or older, under 65 with a qualifying disability, or any person that has end-stage renal disease qualifies for Medicare. It is important to know that if you are on disability benefits for 24 months consecutively, Medicare will enroll you in Part A automatically. So there are different coverage options. There is Part A, Part B, Part C, Part D, and Medicare Supplement. We will be going over each one individually. The first one is Original Medicare. So we have Part A and Part B. Part A covers hospital services, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. Part A normally does not have a premium if you have worked 40 quarters or you've been working at least 10 years. The 2025 deductible for Part A is $1,676, but please note that this deductible will be changing for 2026. We don't have that figure just yet, just because they usually release that information in October. The other thing I wanted to mention about Part A is if you collect Social Security benefits, they will automatically enroll you in Part A, retroactively 6 months. So if you are over 65 years old and you have an HSA account with your employer plan, it's important to know that you will be retroactively enrolled and you cannot contribute to the HSA account once you have Part A or B. Now, Part A covers the first 60 days of a hospital stay, and then after that, you have a copay for each day. You can use Part A at any hospital that accepts Medicare assignment. And accepting Medicare assignment, all it means is that they are willing to accept the amount the Medicare says is fair. Hospital insurance, which is Part A, is not available outside the United States. So normally our clients would purchase a travel insurance policy when traveling outside the state. Part B covers physician services, outpatient hospital services, ambulance, outpatient mental health, lab services, durable medical equipment such as wheelchairs, oxygen, outpatient physical, occupational, and speech language therapy, and sub-preventative care. The cost for Part B, it is basically for 2025, it's $185 per month. And for 2026, it is projected to go up to $206.50. And again, that amount will be finalized in October, but since I have the amount, I wanted to share it with you. Original Medicare Part B covers 80% of Medicare approved costs, and you would pay 20%. Now, the other thing I wanted to mention, $185 is the standard premium. What that means is if you make more than $106,000 annually or $212,000 if you're married, Social Security will charge you more for Part B. They go off of the modified adjusted gross income from 2 years ago. So for example, in 2025, they are using the information from 2023. In 2026, they will use the information from 2024. Now, a lot of individuals do not make the same amount of income once they retire. So if you are in that scenario, you are able to submit an appeal to Social Security, letting them know you no longer made that income and you want them to review the current year versus 2 years. And the way that process works, you submit an application to Social Security. They will require you to submit your tax returns to prove that you no longer make that income. And then that process would take about 90 days for them to review and make a decision then. And then Part B, it's the same thing as Part A. You're able to use it with any doctor that accepts Medicare assignment. If they do not accept Medicare assignment, it is important to know that you will be responsible for the full cost since they're considered private doctors. What's not covered by Medicare Part B? Part B does not cover the Part A nor the Part B deductibles, the Part B excess charges, the outpatient prescription drugs, and they do not offer benefits such as hearing, vision, and most dental. And that's what original A and B do not cover. So most of the time, clients will want an additional policy in addition to A and B, which is the hospital and the doctor services. Another important factor is that long-term care is not covered by original Medicare A or B. Part D plans will cover medications, and they are offered through private insurance companies. You have to have Part A or B, and if you don't want to enroll in Part B, and we'll discuss that later, that's totally okay. But you will want to enroll in Part A if you want to get a Part D plan. The government requires you to have a Part D plan in place as soon as you turn 65. So if you want to have a Part D in place just to satisfy that requirement, that is something you'd want to do. And you can use the Part D plans at a retail pharmacy or a mail order. Part D plans have different benefits. They do vary from plan to plan. They have a stage called the catastrophic coverage, which we will go over in the next slide. The benefits change year to year. The coverage is not automatically, and they do have penalties, as I just mentioned, if you don't enroll in a Part D plan as soon as you turn 65. Each plan has a different list of medications that are covered by each plan. So it's important to review those every year. The drug formulary. So basically, each plan will have a different cost depending on the plan itself. But if it's a brand name, you'll be paying a higher copay tier. If it's a generic, you'll have a lower cost copay. The other thing I wanted to mention, which is very important, is that Part D plans, there are some medications that are high cost that have something they call step therapy. And step therapy is basically means that they require you to first try lower cost medications before they're willing to cover higher cost brand name medications. Now, if you don't want to go through this and you really need a higher cost medication to be covered, you can submit an appeal to the insurance company, but it is subject to review and approval. And that appeal is usually submitted either by you or your doctor. The other important factor is if you have a Part D plan for a given year, and that medication required you to go through that special process and they approve it, but then you change it for the next year to another plan, that approval will no longer be there. So you'll have to go through that process all over again. The coverage stages. So the coverage stages for Part D are very different than a regular employer plan. They have 3 for 2025, and I'll explain that why. So there's 3 stages. There's the annual deductible, the initial coverage, the catastrophic coverage stage. If the plan has a deductible, you'll first pay that. Once satisfied, the insurance company will start covering the medications at the copay that corresponds for the tier that it's in. Once you have paid up to $2,000, as well as the insurance company, so the cost that you and the insurance company have paid add up to $2,000, you'll go into the catastrophic stage, which means you will not pay anything for the remainder of the year. This was not the case before January 1st, 2025. They used to have what they call the coverage gap, also known as a donut hole. And what that meant was when you reached that coverage gap, you were responsible for paying 50% of brand name and 50% of generic medication. That is gone, which is actually a very good thing for everyone, but it did increase the pricing across the board for all Part D plans. And please note that the coverage stages do reset every January 1st of each year. The 2025 cost sharing for Part D, the annual deductible can be up to $590 for 2025. It is changing to $615 for 2026. And again, that is projected. It will be finalized in October and released by Medicare. Not all the plans have a deductible. The ones that don't have a higher premium. And as we just discussed, the initial coverage is $2,000. For 2026, it will be going up to $2,100. So when that $2,100 of your cost and the insurance company has been reached, you will enter the catastrophic coverage stage, which is where you don't pay anymore for your medication for the remainder of the year. Now, Medicare Advantage plans, these are what they call Part C. It is 3 in 1. Your Part A, which is your hospital, your Part B, which is your doctor services, your Part D, which is your medication coverage, all in one. They are offered by different insurance companies, and they usually do have more benefits than A and B would, such as dental, vision, and hearing. You must have Part A and Part B in place, live in the plan service area. It is important that you make an informed decision because once you are enrolled in a Medicare Advantage plan, you are not able to disenroll at any time, meaning that you have to wait until the open enrollment in October to disenroll from that plan. So if you want to change from that Medicare Advantage plan to get another type of coverage, such as a PPO, and we'll go over that shortly, you can't just get out of it. You're basically restricted to that plan for the whole year. The plan premiums and the benefits change year to year. That's another, one of the negative factors of Medicare Advantage plans, because there are doctors that do stop accepting the plans throughout the year. And if you're restricted to seeing that one doctor, you will not be able to see that doctor anymore. It includes the prescription drug coverage. It is limited to the service area. And I would say that the biggest drawback to having an HMO plan, which is the Medicare Advantage plan, is that you are restricted to the one primary care physician. And if you need to see a specialist, you have to see that one doctor to get a referral. So if you would like to go to any doctor, any hospital that accepts Medicare assignment, you have that flexibility with another type of plan and not the Medicare Advantage. And I just want to point that out because Medicare Advantage plans are good, but they're usually for those individuals that do not mind just being restricted to the one doctor and don't really care for flexibility. These are the different types of Medicare Advantage plans. We have the HMO, which is mostly what we have in California. The HMO POS acts the same way. And then the PPO plans, they are disappearing more and more. Medicare Advantage PPO plans are available in some counties, but given the information that we just learned, they are most likely not going to be available in the coming year. The special needs plans, those are usually HMO as well, which is the one that restricts you to the one doctor, and they are for Medicare and Medicaid beneficiaries. The other type of Medicare Advantage plans, which are the private fee-for-service, Medicare savings accounts, and the Medicare cost plans, those are usually in other states. They're not in California, but they act the same way. The Medicare supplement plans are the ones that act more like PPO plans. They do cover the gaps in original Medicare. So for example, you have the coverage of the 20% of original Medicare, and I'm sorry, you would pay the 20%, the Medicare supplement would pay that 20%. So you would only pay your premium and all those gaps disappear, but not by all these plans. So they have different Medicare supplement plans that go by letter, saying A, B, C, D, F, G, K, L, M, N. But the most commonly sold are Plan F and Plan G. Plan F and Plan G basically cover all the co-pays with the exception that Plan G does not cover the Part B annual deductible. Plan F is no longer available for Medicare beneficiaries who turn 65 as of January 1st, 2020, only for those that turn 65 before then. Plan G is a plan that is for people that turn 65 after January 1st, 2020. The other plans, they do cover the gaps, but not all of them. And that's why most individuals do opt to enroll in either F or G, depending when you turn 65. To get in a Medicare supplement plan, you must be enrolled in Medicare Part A and Part B, a resident in the state in which you are applying for the coverage, and you're 65 or older. There are some insurance companies that will accept under 65 on disability, but since they are disabled, there are not that many that accept them. The Medicare supplement plans, they help with those out-of-pocket costs not covered by original Medicare. The benefits are the same with all the insurance companies. What that means is if you go enroll in a Plan G with Blue Shield, and then you enroll with another company, United Healthcare on Plan G, the benefits will be identical with the exception of the premium. And the insurance company bases that based on your age, your gender, whether you smoke or not, and where you live. Medicare supplement plans, they're a little bit harder to get in if you do not apply during your open enrollment. What that means is when you are newly eligible for Medicare and you apply for Part B, you have a six-month window to apply for that Medicare supplement policy and be accepted. They cannot deny you if based on your medical history. Now, if you go past your 65th birthday and you want to enroll in this type of coverage at a later time, they will go through your medical history and can deny you. So it is important to know that if this is the type of coverage you want to have, you should consider enrolling within the 6-month window. Your plan choices are either your Part A and Part B, which is just the hospital and doctor services, the 80% coverage, but you still have that 20% responsibility, which is why most people opt for an additional plan, such as having the Part D plan with a supplemental plan. The supplemental will cover the gaps, and then the Part D will cover your medications. The other choice we have, as we just reviewed, is the Medicare Advantage, which is a Part C, and it includes the drug coverage. When can you enroll? You have a 7-month window. When you're turning 65, it's 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. That is referred as the initial enrollment period, which is when most individuals enroll, unless you are working and you have an employer plan and you still want to remain enrolled. So what happens if you work past age 65? You can still enroll in Part A and Part B, but it's mostly dependent upon the coverage you have and if your employer is either a small or large group. What that means is if your employer has less than 20 employees, it's considered a small group. And in that case, Medicare will be primary and the employer plan will become secondary. It's important to check with your HR department if they want you to enroll in Part A and Part B, because if you don't have Part A and Part B, the insurance company may say, well, we're not going to cover any of the claims. Now, if you have a large group, which is more than 20 employees, then usually the employer plan is primary and Medicare becomes secondary. In those type of cases, usually you don't have to worry about enrolling in A or B. And this is what we just went over. So if you do work past beyond 65, it's important to consider whether it's a small or large group. And if you're not sure, the HR department should be able to tell you. But it's very important to consider that information when you're turning 65. The other thing I wanted to mention before I go on to the next slide, if you are working and you decide to enroll in Part A or B at a later time, you do have to apply ahead of time just because it takes 4 to 6 weeks to get an approval from Social Security. There are 2 forms that you need to complete, which is the application for Part B and then also an employment form. The employment form is completed by the employer, and you have to go into a Social Security office or physically mail those forms. You're not able to apply online when you delay enrollment in Part B, just because it's just for people that are brand new to A and B. So it's something to consider because those 2 forms must be mailed together or taken to the office. If they are not submitted, they will not process your enrollment. The Medicare Supplement Open Enrollment is the 6-month window of turning 65 or applying for Part B. If you delay enrolling in Part B because of being in the employer plan, that's still an open enrollment, which will allow you to apply for the Medicare supplement. Additional election periods. So the annual enrollment period is October 15th through December 7th for the coverage to begin January 1st of the following year. This is the time for you to review your coverage, make changes if you'd like. If you have a Medicare Advantage, you can either enroll into another Medicare Advantage or a Part D plan, even apply for a Medicare supplement. You may have to go through medical underwriting or just simply go back to original Medicare. But that is the time to make any switches to any plan you'd like. The open enrollment period is an additional election, which is January 1st through March 31st. Now, this time frame is in case you missed the annual enrollment period and you have a Medicare Advantage plan already in place. You can either switch to another Medicare Advantage plan or go back to original Medicare with a Part D plan, but it is not for those individuals who do not have coverage or just want to switch from one Part D prescription plan to another prescription plan. The special enrollment period, it is for situations such as coming off an employer plan, or you are residing in a skilled nursing facility, or you just became eligible for Medicaid. The next step is to review your enrollment periods, research your options, and if you need the help, we are here to help you. Each year, as an agency, we do help our clients review their medications to make sure that those medications will be covered for the following year. Some doctors do stop taking the coverage they have, so that's another situation where it's important to ensure that your plan will continue to be covered by your doctor. But most importantly, I say it's the medication, since they do change year to year. And then we're going to hold off the questions for the very end, and I'm going to have Dan proceed with the long-term care portion.
Thank you, Monica. I'm going to share my screen, so we'll see. Okay. Thank you. We like to always include information on expenses related to custodial care, nursing home, long-term care, and their relationship to Medicare and any supplemental insurance. The reason is because of the confusion around that type of care. Most folks believe that incurring those custodial type cares, nursing home, etc., those expenses, what's driving that is a chronic illness or even a disability. And so therefore they presume those are covered expenses because they appear to be medical, but they're really not. They're more custodial in nature. And you can see that by the definition of the expenses. Essentially, what you're doing is hiring somebody like a home health person or going into a nursing home to help you with your activities of daily living. And those are defined as things like eating, bathing, dressing, toileting, transferring, like getting from your bed to a wheelchair, that sort of thing. Cognitive issues like Alzheimer's and dementia, those are automatic, even if you don't have the physical impairments of the activities of daily living. But what's important is oftentimes there's some skilled nursing involved, as Monica alluded to, in the Medicare coverage, but that has a limitation of 100 days. So any coverage beyond the skilled nursing prescription, beyond the 100 days, and or the need for care and the expenses incurred for those that are more custodial nature are just not covered by Medicare or any supplemental insurance. Quite frankly, they're not covered by traditional medical, whether it's group or individual. Also, the only coverage for those illnesses is extended by Medi-Cal in the state of California or Medicaid in other states. Is the point. Why we're bringing this up, or why we include it in this particular discussion, is that there's a high probability that you're going to incur these uncovered expenses. So they deserve planning or attention. The United States Department of Health and Human Services has done a survey, and they determined that 70% of all of us who exceed the age 65 are going to incur these uncovered expenses. So again, given that probability, we think it deserves a lot of attention. Looking at care settings. So there are multiple care settings and even some cottage industries like adult daycare, we're calling community care housing here. But you have the traditional nursing home that most of us don't want to end up in. And then, of course, you have the home health care where you bring a home health aide into your home to provide the services. But the duration can last from 2.5 years to 5 years. And if one transitions, and that's oftentimes the case between care settings, so you might go from a home health care aide to a more formalized nursing home facility, then they will elongate these years or the length of stay. This is, again, government statistics, and you can see that the overall cost is tantamount. It's over $600 billion. And probably the most significant point is that the graph demonstrates that it's an exponentially increasing financial line. So it is a significant cost that we must be involved with. So if we drill down on the cost, and again, these are government statistics, and they're also average. You can see that the cost could run from $253 per day, $7,998 per month. Getting a home health aide into your home on average could cost $20 per hour. Again, these are averages. If we look at the state of California, they're tantamount to 2 times those figures. So the daily costs will run from $400 to $500 in a nursing facility, which could be $12,000 to $14,000 per month. And that in-home healthcare aid could cost $40 per hour. So you can see this can significantly impact your financial or accumulated wealth. The total cost is not just financial. What we've also noted, and we hear consistently, is that a family member will take care of those needs. So there's no need, or that'll be our plan. But what we've found is that it's debilitating care and will erode the general health of the caregiver. So we'd like you to consider that we understand that's an option, but we'd like you to consider that it may be broader than just the monetary aspect of this. So bottom line, with medical and technological advances, we're living better, healthier, and longer lives than our parents. And it's because of this very longevity that's putting us in a situation that there's a high probability, a likelihood that we're going to experience the significant financial impact of these uncovered items. So it demands planning. We invite you to look at it and anticipate your Halbert Hargrove advisor including this conversation in your general planning sessions. So thank you. Monica?
Okay, so I'm going to proceed with answering the questions we have. We only have 2 so far. The first one's from Denny Page. He had difficulty hearing the difference between B as in boy and D as in David. Part B as in boy is the doctor services, and Part D as in David is the prescription drug plan. I'm sorry that, B and D, they all sound very similar. The other question we have, I'm sorry,
Monica, we like to say D is for drugs. It's the one acronym that actually makes sense. And the other confusing part, if they haven't got to it, is these supplemental plans are also alphabetical letters, which Monica spoke to. And so that's oftentimes the confusion. The folks come to us with confusion. It's like Part A, B, C, D, et cetera, as Monica alluded to, and then Plan A, B, C, D, and as Monica alluded to. So plans the insurance, supplemental insurance opportunity, and the part is those that's administered by the government.
Correct. And then the other question, can you use the HSA account to pay for any of these supplement plans? The answer is no. They do not consider the Medicare supplement premium qualified medical expenses, but you can use it for Part D premium, the prescription drugs and medications, but not for the Medicare supplement premiums, unfortunately. And those guidelines are set by the government, unfortunately. Do we have any additional questions? The next question, when is the best time to enroll if you are still working? Any penalty if delay? So the best time to enroll, it all depends on the coverage you have right now. If you're happy with the coverage, how much you're paying, and your benefits. There are some clients that pay a very high premium and the benefits are not great. So in that kind of scenario, it's important to compare what you would be getting if you transfer to Medicare. If you are enrolled in an employer plan that has what they consider credible Part B prescription coverage, what that means is that your medication coverage pays at least what a Part D prescription plan would pay. If it's credible, then you would not have a penalty for Part D as in David. And your HR department is able to tell you if it's credible to Medicare or not, since they are required to report that information to CMS each year. The penalty, if you were to not have credible coverage, is 1% of the national base beneficiary premium times the number of months that you don't have a prescription drug plan in place that's credible to Medicare. So the penalty does vary depending if you have that credible coverage or not. But that is the answer. Once you come off the employer plan, you will have 8 months to enroll in Part B without a penalty, and 2 months to enroll in a Medicare Advantage, and 6 months to enroll in a supplemental. So there's a lot of different timelines depending on what coverage you're going to go with, but basically you will have the time to enroll without being penalized. The only thing that I would really recommend is confirming that your current coverage has that prescription coverage that's credible to Medicare to avoid that penalty. The other thing I wanted to mention is that COBRA, just in case you ever do get COBRA after coming off the employer plan, it's not credible for Part B as in boy. So if you decide to enroll in COBRA, know that the penalty would apply, so you do want to apply for Medicare. The other situation that I had mentioned was if your Part D plan is not credible, but you have good coverage, you can always apply for Part A only, which is usually free if you have worked with 10 years, 40 quarters. Then you have your Part A in place and your prescription plan to avoid that penalty.
Monica, would you speak? COBRA is very important because we've had folks come to us where they've elected the COBRA option and went past age 65. Would you address the fact that the government, Medicare, CMS doesn't consider COBRA group insurance? So you consider a late enrollment if you've gone past age 65 under COBRA. And that's not a good situation to be in because you could be in an uncovered situation and have critical illnesses. So
correct. Yeah, well, as soon as you come off that employer plan, even though it's the same exact coverage, it's just COBRA, it's not considered credible for Part B. And the penalty for that is 10% of the standard Part B premium for each 12-month period that you were eligible and did not enroll in Part B. I did want to note though, COBRA is not credible for Part B as in boy. but it can be credible for Part D as in David. And why is that? Because the government does consider that your medication coverage, if it pays at least as much as the Part D prescription plan would pay, then if it's credible, then you're okay. So two scenarios, Part B as in boy, Part D as in David. The penalty can apply for Part B. It can apply for the COBRA penalty would apply for only the Part B portion and not D as in David. I was getting mixed up with the B and the D. Sorry.
With the alphabet. Yeah, so basically our counsel is, it's not as easy, the decision is not as easy as it appears. And you have to make intentional actions. So Monica alluded to, is the employer you work with past age 65, is it less than 20 employees? That's one, that impacts your decision, even though you have nothing to do with how many employees your employer employs. As a point, if it's above 20, that's a different decision. You may have retirement plans, and again, you work past 65, so you're going to be covered under the group. But is the group going to be sufficient to satisfy the requirements of Medicare so that you're not considered uninsured and have waiting periods and compromising your care? That is also part of the Medicare statute. So it's an involved decision, and it's unfortunate and something that's so important, but we advise you to get really good, credible counsel. That's somebody that's active in this arena, because a lot of moving parts, and it doesn't matter the caliber of person or the nature of your employment. I had a vice president of Occidental Petroleum come to me in an uninsured situation because he was advised to take COBRA after the COBRA extension of coverage after his age 65 and after his retirement. Really, really bad decision. So again, our advice here is just get really good, credible counsel. Okay.
Okay. One of the questions, did you say you can use the HSA funds for deductibles and drug plans? Yes, you can use it for the drug plan premiums and medications. What is the advantage of applying for Medicare once you're eligible if you're still working? The advantage is some plans have a very high deductible, the employer plans, but again, if you have a low deductible, you have good prescription coverage, then I would recommend you to stay in the employer plan. And also how much you're paying each month out of pocket for that plan. But if your medication coverage is not good, you're paying a high premium, then it's advisable that you consider looking at how your medications would be covered with a Medicare Part D plan and a supplemental. At the same time, the income-related Medicare adjustment amount, known as IRMA, that's very important to consider, because a lot of our clients, when they look at all the total costs, you're paying Part B as in boy, then you're paying your Part D as in David for medications, you're paying your supplemental premium, then you're paying your income-related Medicare adjustment amount, which is an additional 2 fees for Part D as in David and Part D. So all those costs do add up, and they may be more than what you're paying for your employer plan. And we do help our clients with that. So if you have questions, you can always compare your current coverage with how much it would cost with getting a supplemental and a Part D plan. That way you are able to see what is best for you, whether it's to remain enrolled with your employer plan or opt for Medicare. And then
I would just add, Monica, that it's a flat out value proposition if you're still working. As Monica indicated, what's my cost and what am I getting for it through the group? What's my cost and what am I getting for it? The value of the plan, co-pays and such under Medicare. And it's generally a financial equation, but a value proposition too.
Yes, and then also there are some medications that are not covered by Medicare, especially the high cost ones. So if you have high cost medications, it's important that you confirm they will be covered, and if they are, how much will they cover under Medicare? Because we have clients that have very good coverage for some high cost medications, and when they transition to Medicare, they don't have that coverage anymore. So it's one of the very negative factors.
And don't forget the spouse.
What are
Yeah, where your spouse may be younger than you, and that's got to be part of your, what I indicated is planning. Is that all right? The spouse is a year or two younger. How do I plan to maintain coverage, the most appropriate coverage for my spouse or significant other?
Yes. And the other question I have is, what are the best ways to use the funds from the HSA? Well, if you have a supplemental plan, that supplemental will pick up that 20%. So you will not have co-pays or out-of-pocket costs with the exception of the premium. And you can't use the HSA account for that. But if you have a Part D as in David, which you would, for prescription drugs with a supplemental, that's what you would use those HSA funds for. Also, dental coverage, the plans in the market, and I say market because the Medicare plans are not really good either. So your HSA will probably be going for your dental benefits, any costs associated with that, medications, vision, those kind of costs will be covered by HSA. Dan, I don't know if you have any additional input in what they can use those HSA funds for.
No, you've expressed it well, Monica. The idea is HSA requires an underlying qualifying plan, which Medicare wouldn't be. So you wouldn't have that. So what your employer would do that, or maybe have an HMO that again does not qualify, a group HMO that doesn't qualify for the HSA account. But your group employer, they can create a limited or modified HSA account, which is just limited to items that Monica expressed, dental, vision, programs like that are non-medical.
Correct. The other question we got, I am 66, but still informed and was told my company's insurance is good. I am retiring in 3.5 months. When should I be talking to an agent and applying? I did enroll in A at 65, and what form does my HR person need to give me? Or is it something she needs to send the Medicare office? Okay, so you're 66, retiring in 3.5 months. Usually the process takes about 6 to 8 weeks, and I say 8 weeks now because we have had a lot of clients that have been having issues with Social Security and they're taking a lot longer than usual. So I would say at least 1.5 months ahead of the time. There are 2 forms. One's called application for Part B, and the other one is called employment form. The employment form is the one that needs to be completed by your HR department. You would submit both together to the Social Security office, either make an appointment and take them in person, or you can mail them. Once you have done that, I would recommend contacting them to verify they received it and they are in process, just because it's the government and we have had cases where the documents are sent off and they don't go anywhere, meaning they're sitting in someone's desk and you have to proactively confirm that they are in fact in process. Once you have the Medicare Part A and Part B in place and you get confirmation, then we would help you with looking for a Part B prescription drug coverage or a supplemental plan or a Medicare Advantage, whichever plan is most suitable for you. But I would say at least 1.5 months ahead of time so you can start that process and then move forward from that. Oh, and I just want to make sure that I made it clear that you would be the one taking those documents to the Social Security office. The HR would just complete them for you, but you have to obtain it, which we can help you with that too. We can email you the form, and then that way you have that ahead of time. And the next question. I've been denied an appeal of a medication my physician highly recommends. A letter informs me I can appeal to an administrative law judge. Is this step worth the effort? I assume is unlikely to reverse the decision. I would agree with that, just because we have seen cases like that where if that medication is not part of the formulary and then they don't want to cover it and an exception is not made, they usually deny it. I mean, you can try, but from experience, usually they don't change the decision. And that was one of the main important factors that I want to make sure is considered when considering the Medicare Part D as in David coverage, because the medications that are covered, they're very strict with those. And if it's not, then you have to pay for it out of pocket, unfortunately.
Monica, I will add, it's not a Medicare perspective, it's a group perspective or just general medicine. And that is that the programs you see advertised like Single Care, Clever RX, and a few programs like discount programs like that, they're quite effective. So in their apps that you just can avail yourself of without any cost. That would be one solution to mitigating the expense. The other is MAP, which are manufacturer's assistance programs. So if you went to that medications manufacturer's website, you'll find a tab for that. And there's two aspects. One is just, to be crude, this is just too darn expensive. You know, can I have a discount coupon to reduce the cost when I buy it from the pharmacy? That's one side of it. There's another that says that you could qualify for a superior or greater discounts from the manufacturers if you qualify or are eligible based on your income or your family household income. So it invites you to look to those programs. They're quite prolific, and they almost have to be, because I suspect you're looking at serious costs for this medication if it's uncovered. We've seen hellacious expenses, $50,000, $20,000, $80,000 a year, things like that, which is just intolerable for any of us, no matter our income. Okay.
The next question, what cost does Medicare cover if you are out of the country? When you're out of the country, honestly, you don't have coverage, only in emergency situations. And most of our clients do get a travel insurance policy just to make sure you don't go through that of not having any coverage while being out of the United States.
But Monica, the supplement plans, the alphabet plans, they have a bit of coverage, don't they? Still some?
Plan S. Plan S as in Frank, the one that is no longer available to newly eligible as of January 1st, 2020. It did cover some travel insurance outside the United States, but the government basically took that benefit out for the Plan G as in George. And that's the main reason that clients opt for the travel insurance versus just Medicare alone.
So any of those lucky folks that have Plan F and their grandfather, they do have, what was it, 50,000 of coverage for travel outside? Thank you.
I sold a home last year. The capital gains were significant. Will that trigger a higher premium? 2024. Yes. So in that case, in 2026, they will use your income, your modified adjusted gross income reported to the IRS, which will count, but you can't submit that appeal. So you can submit that appeal to Social Security and submit your returns, basically showing that that is not how much you normally make. And they will make a determination based on that, which I can easily see that being approved since it's not something that you would normally have. But you have to ask them to consider the present year versus 2024. And it does take up to 90 days for them to review and make a decision.
Monica, your team has access to that form, no?
Yeah, we do have that. So we can send it to you via email. I don't recommend sending it through mail, but the options are either mail or in person to submit that appeal to Social Security. Since it's a lot of personal information, I would rather not send it by mail, but those are the two options. Take that form in with your tax returns to prove that you're no longer making that same income from 2 years ago. And that is the last question that we have on the Q&A. Is there anyone else? No.
Thank you, folks.
Thank you. So we'll just conclude the presentation now.